let's dive into a little bit of coaching. I want to kind of dive a little bit deeper into the foundational anatomy types of education. I know I've talked about this before in the past, but I do think it's worth a refresher because it's really important. Whether you're at the very beginning and just getting into the assessments and trying to figure out the little pieces, or if you're farther along and doing more advanced or dynamic stuff, the same concept is going to be super huge. So I want to talk a little bit about the different foundational levels starting from the inside out, right? So from the pelvic floor out, I have created these foundational levels. So again, if you have questions, let me know because it's not like you can really Google this information, but there's three main levels, okay? When we think of establishing a solid foundation for our body, we want to make sure everything from the deepest aspects outwards is accounted for. Okay, so that deepest layer, that first foundational level is going to be literally level one, and it consists of those pelvic floor muscles internally, and it includes all the deep hip rotators. So you hear us talk a lot about the obturators in this, scenario because of how often they're involved. Obturator internus, obturator externus, those are two huge ones. There's also a couple others. There's quadratus femoris, there's inferior and superior gemellus muscles, and then we have the piriformis. I'm still going to include that as almost that deepest foundational layer. So the reason I bring these guys up is because oftentimes we're not as aware of these muscles compared to some of the bigger muscles that we maybe have tension or pain or tightness or things like that. So like the TFL, the QL, the hamstrings, adductors, those are some of the muscles that we're just more used to hearing and have been treated in the past. And for those muscles to fully be addressed and supported, we have to dive deeper. Okay. So that's why for almost all of you, we highly recommend the internal assessments. And for most all of you, there's something that we're guiding you with from an internal release technique standpoint so that you can not only specifically target those deeper muscles from a tactile standpoint and a physiological standpoint, but also you can start to rework that brain's awareness for those deeper muscles. Because for a lot of us, there's a disconnect between what we are feeling and what is physically going on there because we just don't have the same awareness or exposure to it. So somebody might have, let's say, a lot of our typical symptoms or a recurring chronic hip pain or even some pelvic floor limitations. But when they first go to test their pelvic floor, everything seems fine, right? They score themselves a 3 out of 3 and there's no big like trigger points or symptom reproduction that they are feeling because their brain literally doesn't have the awareness to decipher the difference between the muscle groups within the pelvic floor or the layers, right? The more superficial versus deep layers, or even sometimes left versus right sides. For some people, it is challenging to figure out where they actually are internally. So if you're somebody who is going through the pelvic floor assessments, again, whether this is early at the beginning or later on, when you're doing more dynamic things, if you're reassessing the pelvic floor and everything seems good or normal, or like you're scoring 3 out of 3s, but you're still having some of these recurring symptoms, that's telling us there is actually something deeper going on. And there might be a specific exercise we're guiding you to, or there might be a specific like nervous system or brain activity that we're guiding you to, depending on what the main roadblock is to really establishing a solid foundation within those deeper layers. Okay, that foundational level 1, those deeper muscles, we cannot ignore them. And that's where we just want to make sure you guys have full clarity and confidence that you're doing the right thing, especially with something like the wand or something like internal rotation based movements because of how they target some of those deeper hip rotators. Once we've established solid control or just awareness there, even if it's something you're working on, so even if the level 1 isn't perfect, as long as we're working on it in some way and you feel like you have a tool that's helping you there, bringing in the next foundational level is going to be really important. And that's where we talk about the hamstrings and the adductors specifically. There's additional assessments we might do for each of those pieces because of how important they are. And they both insert on the pelvis themselves. So they really help almost like maintain whatever it is that you're working on deeper by adding this next layer of support with appropriate control or activation or, cueing in certain muscles or in certain movements. So the adductors and the hamstrings become very important, as do the feet. Okay, the feet are going to be part of this second level of foundation because of how specifically they stabilize up the chain with those rotators, those hip rotators, and also within the pelvic floor. Okay, there's a lot of fascial lines, especially through the front part of your body, through the psoas, the iliacus, the pelvic floor, and our dorsiflexors. So the muscles in our ankle that bring our foot up. Many of us have restrictions with our dorsiflexion mobility. So we're stiff. We're not, 5 inches of mobility, when we're doing our ankle assessments. We need to improve that because of not only the neural muscular control aspect of it, but because of the fascial line connection of it. And because of the type of dynamic stability we want to train the foot to have with the deeper hip muscles and vice versa. So again, if let's say you're farther along in your program or we're adding on more advanced exercises and you're starting to have setbacks or flare-ups or just stubborn symptoms that you don't feel you can work through, we can't ignore the role the foot is playing. We have to feel solid that our hamstrings and our adductors are stabilizing the way they need to. And we have to make sure that those deeper muscles are still staying happy. There's no trigger points developing, or there's no guarding or tension points developing as we start to do more for the body as well. Okay, so let's talk about level 3. This is now where we're going to bring in more specifically the TFL, the QL, iliacus, psoas, all of those great common muscles that most of us are aware of, either from prior rehab or your own awareness, or the fact that that's where you're having symptoms or like compensation patterns. So for example, if you're doing internal rotation based things and you feel it a lot in the front of your hip, like that TFL or those hip flexors are really trying to kick in and help, that's where at this level, we're really trying to reduce those compensations so that the muscles are still getting worked, right? We still want them to show up and do their part, but it's just going to be in collaboration with everything else muscle wise. So those muscles are really important for level 3, as are things in the shoulder. So serratus anterior, lower traps, just our scapular muscles, those are going to be really important pieces of just that trunk stability. The breathing, obviously, if we're lifting weights overhead or if we're running and moving our arms, we need the upper body to be on board as well. So that's where we really start to look more above and below just that trunk, pelvis, hip area, and making sure that, from side to side, things are feeling good, but also with the oblique slings that we talk about, right? Can that dynamic stability occur effectively? Is there anything off or different or compensating when you get to that level and start to add some challenge with those types of exercises, just so that we make sure that we're not missing anything important for your body's awareness, especially if it's a compensation pattern that isn't a pain-provoking one, right? And it's, again, not like we're trying to be perfectly symmetrical with everything that we do. Like, nobody is perfectly symmetrical. That's not realistic. But we want to make sure that we're aware of what's going on and that we have control over them so that we can continue to enhance how the muscles show up and work together and just minimize the effect that any compensations or discrepancies may have on function or performance or pain or things like that. So I won't dive too deep into level 3 just because there's a lot that can go on with that. But I do think it's helpful having these almost like benchmarks in your mind of like, okay, if this is what I'm feeling, like let's cross off, like check our bases, right? Like level 1, are we good there? Is there anything coming up? Do I fully feel confident that I'm doing the right things or that this piece is being fully addressed? Because if you don't fully feel confident, if there's slight hesitation, that means you're probably not ready to just ignore it altogether and move on to more advanced stuff without including the deeper layer. So every step of the way, we're trying to, just check our boxes. Is the level 1, that deep level, accounted for? Do I feel good with it? Am I improving with my assessments or my function or how my exercises feel? If so, great. Level 2, how are my feet actually feeling? Right? What if you feel great in the hips and pelvis, but there's just this nagging thing going on with your foot that you can't get through? We don't want to ignore that because that's part of what our body is trying to get our attention for, right? And even if it's like we're not changing the bunion or removing it altogether, that's okay. We can still improve our control around it so that it's just working a little bit better with everything, else going on in the body. And then obviously the hip flexors, right? The QL, the low back, the rest of the core muscles. What else needs to occur within those areas so that we know, hey, as soon as we add more weights or more load or change, just the overall challenge that your full body is going through, we know that the foundation is able to stay up to the task at hand and not just feed into something else, down the road that, is another frustrating annoyance or injury because we didn't actually create a solid foundation initially.